is you can look in the phone book, and we live in Edmond. It's a pretty big population, and there's probably 15 vets there. So how do you pick a vet out from that? Well, and I think the answer is that that's not necessarily the right way to do it. I think what you should be doing is talking to other people who have had experience with those various vets to say what they say about them. I think the word of mouth is, and I'm guessing, Dr. Matusik, that a lot of your business is word of mouth.
Absolutely.
Do you advertise anywhere?
So we do. We have obviously a website. We do some Facebook advertising just to get out there. But like you mentioned, James, 80% of our new clients come here based on word of mouth. So that's an excellent point that you've made. And I think what makes a decision for most people in making the decision when trying to find a veterinarian is their level of compassion and caring.
I agree.
Not just for the animal, but for the client as well. Because every one of our patients has an owner attached, and we've got to take care of both.
This decision to come here was made a better part of a decade ago, and we've used a lot of vets, and they've all been good. I don't want to knock any of the other vets, but the level of support, the level of care, the level of commitment, and the level of trustworthiness that we see here is honestly second to none. So you get a big attaboy on that.
Thank you, James.
I mean, give you an example of this. How many vets do you think, Dr. Matusik, have got emergency numbers? And they will take a phone call on a weekend?
Well, I'm slowly learning not very many.
Not very many. None of the ones that I've ever dealt with. I think you probably don't publish your emergency number, right?
So our clients have access to our emergency number through a voice messaging system. So when they call after hours, there is a voicemail on our phone for any established clients to have access to us.
So I think that's an important point here, is if you think that you're going to get emergency service from a vet you've never seen before, it ain't going to happen.
That's correct.
Because they don't know whether you're going to show up. They don't know anything about your dog. You've got to establish a relationship. And if you don't do that, you're going to an emergency hospital.
I think what's also important to realize is that we are still in a rural community here in Kingfisher, which we love. So we are private practitioners, and we are providing emergency services to our clients after hours. So in other words, after we close the doors and we've worked a full day, we are coming back up here
as necessary.
When necessary to support our clients, take care of our patients. And we are dedicated to doing that with our established clients. We can't do that for non-established clients, or we would be up here all the time. And therefore, I think our level of dedication would suffer if we were up here all the time on emergencies. So, there are many emergency clinics in bigger towns, bigger cities, i.e. Oklahoma City, and there are occasions where we need to send some of our patients to the city for specialty care, or just whenever, we may have several emergencies lined up, and if we feel that the patient needs expert care right then in a time period that we may not be able to see them in, then we will send them to the city. But I think for the most part that private practitioners are probably going away from emergency care due to the advent of the emergency care in these bigger cities.
Well, so I'm going to tell you a little bit about this situation for us. And this is not the first time this has happened. So late Sunday afternoon, I gave you a call.
That's right.
And I said, I've got a dog that needs a C-section, but I think it'll be tomorrow, and we'll be okay tonight. And Dr. Matusik said to me, okay, that sounds great, but if you have a problem, you've got my emergency number, call me. So then what happened is 8 o'clock rolled around, and I got a phone call from Dr. Matusik to ask me what's going on with the dog. So it is an extraordinary level of care, in my opinion, in that somebody not only is there for emergency services when I need them, but also that they are concerned about what the heck's going on to make sure that they can do whatever they need for me and my dog. That's cool. So appreciate that a lot.
You're most welcome, James.
Right. So, there's some other things as well that one of the things that people are concerned about is cost. I don't think that's a huge factor in the whole thing, but I would say this about Wheatland Veterinary is that my daughter, for instance, comes and gets her meds from here rather than getting it from a local vet because your price is so competitive. So again, it's not, I don't want to harp on prices being the number one thing. It's not, it's fairly low down the list, but I think that expertise, how many dogs have you got here?
So we have 3 full-time veterinarians here. I'm the owner, and I have 2 very well-trained associates. And then we also, on Wednesdays, we are blessed to have some equine specialists who come in on Wednesdays to support our equine clients, not only here in Kingfisher County, but also across northwest Oklahoma. So we have quite a few equine clients from other towns.
So this is kind of unusual in that you've got, it's Kingfisher's population is what, 5,000, 7,000
Yeah, it's
people?
going to be roughly 5.
Yeah, 5,000 people. So it's not a big town. Now here we are about 40 miles from Oklahoma City, but here we are with a veterinary practice. It's been around since 1981 that has 3 full-time vets to do small animals, dogs, cats, I mean even hamsters and mice, I'm guessing, I mean little...
Yeah, a few.
Yeah.
So
big animals and horses.
Yes, that's right. So we are truly a mixed animal practice.
Right.
And we are continually developing our surgical procedures that we want to offer, as well as routine medical care as well, and diagnostics that we offer here.
So there you go. So that's it. That's a Wheatland Veterinary in north side of Kingfisher, which is kind of mid-Oklahoma. And I know that a lot of you, again, don't just make a phone call and come up here and expect to get a C-section done. He wants to know you. He wants to know your dog.
That's right.
Before, it's just the right way to do business. So anyway, but again, a big shout out for you. I've done a number of videos where I've not talked about the level of service that you provide, and I mean, it's awesome.
Thank you, James.
Yeah, you're welcome. All right, bye, everybody.